Nigeria's future, the federal government says, depends on the health and well-being of its adolescents. At the 2025 International Adolescent Health Week in Abuja, the Ministry of Health and Social Welfare made a strong call for increased investment and multi-sectoral collaboration to strengthen both the physical and mental health of young Nigerians. Representing the coordinating minister, Professor Mohammed Ali Pati, Mrs. Dafeta outlined key milestones including the establishment of an adolescent and school health branch, a funded budget line for adolescent health, and several national policy documents to guide service delivery. She emphasized that while progress has been made, more effort is still required to integrate physical and mental health interventions into adolescent programs nationwide.
Nigeria has a population of 23% adolescents. It goes without saying that to secure and sustain our future economic, social, and political progress and stability, Nigeria needs to make a strong commitment to closing the gaps in the health and development of its adolescents. Some major milestones have been achieved in this regard, worthy of mention. And structurally, the ministry has an adolescent and school health branch that responds to adolescent health programs and interventions. Currently, the ministry has a funded budget line for adolescent health development, and states that do not currently have are encouraged to establish one. The ministry has developed and implemented several adolescent health development policies, including the National Adolescent Health Policy, the Clinical Protocol on Adolescent Health and Development, guidelines and training manuals, among others. There is also the Adolescent Health Development Subcommittee, which serves as a coordination platform to biannually review adolescent health interventions and programs for improved implementation of these initiatives. However, a lot more needs to be done for this subpopulation that constitutes 23% of our population based on the 2022 UNICEF data. Too often, adolescents and young people's health are viewed narrowly, and they are often portrayed negatively. Adolescents are also more often than not kept away from participating in activities that determine their future. The International Adolescent Health Week is an excellent opportunity for Nigeria to join its counterparts globally with full participation of adolescents and adolescent-focused organizations to beam the light on adolescent health and developmental issues. We must ensure access to nutritious food, safe spaces for exercise and education about the importance of sleep hygiene. Schools and communities play a vital role in creating environments that encourage physical activity and discourage harmful behaviors such as substance abuse. Equally important is mental health, which encompasses emotional, psychological, and social well-being. Adolescents face stressors that can lead to anxiety, depression, and other mental health challenges. Stigma and lack of awareness often prevent young people from seeking help. We must therefore foster open conversations about mental health, normalize seeking support, and provide accessible counseling services. Building resilience, teaching coping skills, and promoting positive self-esteem empower adolescents to navigate life's challenges with confidence. Schools, families, and healthcare providers must collaborate to create comprehensive programs that address every aspect of the health of the adolescents.
Speaking on behalf of the Permanent Secretary, Dr. Okaire reaffirmed the ministry's commitment through the RMNCAEH+N platform, a coordinated framework that brings together civil society, the private sector, and international partners to support adolescent health and nutrition initiatives.
Today, the Federal Ministry of Health and our partners is raising awareness on the comprehensive health and well-being of young people aged 10 to 21 years. and we are calling on all stakeholders, including the adolescents and their communities, to collectively and passionately join hands with government and implement the adolescent health and mental health policies of the government, as well as the critical interventions that will support adolescents to transit smoothly to adulthood. The Federal Ministry of Health and Social Welfare, through the Department of Family Health and her agencies, has driven and provided strategic policy direction for increased accessibility, availability, and affordability of critical adolescent youth-friendly health services and interventions for all adolescents, including those in hard-to-reach areas, at all levels of care, particularly at the primary health care level.
The event also featured goodwill messages from key partners, including the World Health Organization, the Society for Family Health, and other civil society organizations working to advance adolescent health and empowerment across Nigeria. Partners praised the federal government for its leadership and pledged continued collaboration to create a healthier, more supportive environment for Nigeria's young people.
This CSP therefore calls on all of us to empower adolescents with the tools and resources they need to thrive in today's complex world. By promoting resilience, we will nurture a generation that is not just surviving but flourishing. We therefore need to prioritize adolescent health in our national development plans, increase the investment, and ensure data-driven actions to better understand their challenges and opportunities. We also need to engage all stakeholders, schools, health organizations, youth groups, and communities in promoting the physical health and mental resilience, and also need to create safe spaces where adolescents can voice concerns, experiences, and share reports.
One of the day's most memorable moments came from a young voice, Peculiar Bassi, a pupil of Karamajiji Junior Secondary School, Abuja, who spoke on behalf of Nigerian adolescents. Her heartfelt appeal captured the spirit of DCS team, thriving inside out, strengthening physical and mental health of adolescents. She urged the government to make health services more youth-friendly and called on parents and teachers to listen without judgments.
Many young people today struggle with things we don't always talk about, like stress, low self-esteem, peer pressure, even loneliness. These challenges affect not just our bodies, but also our minds. That's why we are asking our governments to please make physical and mental health care more accessible and friendly for young people. Our teachers to please look out for students who might be struggling silently. Our communities and parents, sometimes we just need someone to listen without judgment. Advocates and NGOs, thank you for amplifying our voices and for being passionate about us. Please keep reaching to the underserved.
From nutrition and exercise to mental health awareness and counseling, the federal government is calling for stronger collaboration among schools, families, health providers, and community leaders. By investing in adolescent health today, Nigeria invests in a stronger, healthier, and more productive generation.